Okay, this is going to be your walkthrough of the adult Hamilton T1 ventilation competency checkoff. So starting off with, just want you to demonstrate your knowledge of the exterior components and buttons of the ventilator. So starting at the front here, we have our battery compartment. We have our different buttons here on the main menu. So we obviously have our power button here. We have the day and night mode screen dimmer. We have the screen lock. The button with the lungs on it gives a manual breath. The arrow with the O2 next to it temporarily increases your FiO2. This little printer looking button captures the data, kind of like the screenshot on the Pro Pack. And then this little spray bottle is used to initiate the inline neb, which gives a continuous infusion on inhalation only for 15 minutes. And then at the bottom here, we have your alarm silence button, and then the turning and push button control. Now move to this side here, we have your exhaust and in ports, as well as the two flow sensor ports. And then this right here is used for our inline neb. Moving to the back, the only thing of note is this air intake, just making sure that we don't obstruct it and smother the vent. And then moving to this side, we have our high flow O2 port, as well as our power cord. All right, so I'm gonna go ahead and power on the ventilator. And while that's powering on, I'm gonna go ahead and attach my circuit. So remembering this piece goes on and this diaphragm needs to be flush and in line. I take it, I insert it in, and then I turn it clockwise until I feel it seat. From there, I'm going to go ahead and attach my circuit. Remember that the circuit will always be pointed towards the front of the ventilator. And then I'm going to take my two flow sensor tubes. The clear goes on the white, the blue goes on the blue. All right, now that we have our circuit set up, we need to do our pre-op checks. So to do the pre-op checks, we're gonna need this component right here. So we're gonna go ahead and attach it to the end, and then we're gonna go to pre-op check on the screen. And the first one we're gonna do is the tightness check. So I'm gonna hit tightness, and then follow the prompts on the screen. So it says disconnect patient, so the circuit is left open. Tighten patient, I cover this with my hand. It says connect patient, so I'll take my hand off. And then I see that I have a green check mark, so we pass that. So the next test we're gonna do is the flow sensor check. So I'm gonna select flow sensor. Telling me to disconnect patient. So I'm leaving it open, turn flow sensor. So I'm turning this whole piece around. Okay, it tells me to turn the flow sensor again, so I'm going back to its original position. All right, and we have a green check mark, so we've passed our pre-op checks. Remember this O2 cell, we do not do that regularly. We only do that when there is a red X. And we can perform that check while we're ventilating a patient as well. So I'm gonna go ahead and exit the pre-op menu screen.